Joining me again, Assemblywomen Valerie Huttle and Amy Handlin. Now, we talked about this subject on New Jersey Now some time ago. Then again, of course, we were talking about candidates for governor. But these are issues that, of course, we've talked about before. What's your reaction to these new guidelines?
I think it's terrible when these experts come out with all of their proclamations and beliefs without having talked amongst each other and attempted to reach some sort of a consensus, believing that somehow women themselves are going to sift through all this information and figure out what to do with it. That's not fair. That's not fair. And I think that the only clear message that any of us can take from it is simply that women need to trust their own doctors, and they need to trust their own knowledge of their bodies and what's right for them.
And your reaction?
I was shocked and really concerned and really angry, I think, because we were just here last month during Breast Cancer Awareness Month in October saying that early detection saves lives. And that has been ingrained, I think, in this culture of women, this generation of women. Awareness, education, get your mammogram at 40, and you have this on your to-do list for your annual checkup. And I will say that, you know, the statistics may show the evidence, but I wish that they took a more humanistic, medicinal approach for those scientists to make these determinations. And just speaking to the physicians, I think that most physicians at this point will stay on the course of recommending what we're used to on these mammographies.
They talked about things like unnecessary biopsies and also worrying women too much. What do you think about that?
Two things. One, I want to say that I was one of those women who had the so-called unnecessary biopsy. And you know something? We were talking before, and we both agreed that women can deal with anxiety. That's okay. We're not afraid. And the truth is, if I had to do it again, I would do it again because of the peace of mind I had when I was able to go to sleep that night after I found out that the finding was benign, knowing I had evidence that I didn't have cancer. And I think the vast majority of women would see it that way. And to be told that we shouldn't examine and get to know our own body tissue is insulting.
Do you think women are being forced to put a price tag on their bodies somehow?
I agree, and it's you know, I read Gail Collins' op-ed piece this week in the Times, and she said this is the era of medical backtracking.
Right.
In my opinion, we are going backwards, and I fear that the next generation of our daughters coming up, they may not be conditioned to get their mammographies as we are. And I will tell you, Brenda, as a funeral director, I have buried breast cancer victims in their 40s. And I wish that there was a funeral director on that task force so that it is more than just scientific numbers and saying 1 out of 1,000 or 1 out of 1,900. I will show you faces of the 1 or 2 that are the victims of breast cancer. And we have made such strides, and I really, as she said, I hate to go backwards.
And also some guidelines came out about pap smears as well. So then there's now a discussion about cervical cancer. What do you think about all this new information coming out and what it's putting in the minds of women?
Again, it's really utter confusion for people who are not medical professionals. And I hope that all the women listening to us will have a doctor, go to a doctor whom they trust, with whom they have a relationship, and talk about their concerns. And to that point, Brenda, I think the audience has to be aware as well that we have a climate for medical practice here in this state, which is not healthy, if you will. We have many, many radiologists, for example, who no longer want to perform mammograms because they're terrified of baseless lawsuits. And that at least is one small piece of this puzzle that we can work on legislatively, because we can help improve that climate and encourage more doctors to build practices here and then build relationships with women and with all of the other patients of New Jersey.
Do you think it's a matter of, do you think it's a political issue, especially when we talk about the cost involved?
I hope not, Brenda, but I can see it going that way because of the cost and the insurance mandates, and I fear that because of these recommendations, I'm hoping that they take these recommendations in stride, that it is up to the doctor and the patient, but my fear is that they will take these mandates out for women under 50 now, because the new recommendations are 50 and then every 2 years. If I want to continue having my mammographies every year annually after 50 or even in my 40s, I hope that doesn't affect the insurance. Right now, the Secretary of Human Services, Kathy Sabellis, did say that it will not affect Medicare or Medicaid. But that's now. I am really concerned about the future of this. And I would think that the bottom line, don't forget this task force was done from a previous administration. And I am concerned. I don't want to politicize that at all. But I am hoping that these recommendations are looked at and reviewed very carefully and that it doesn't affect the outcome of the access to health care.
What do you think what's your advice to women listening to this program today? What's your advice in terms of getting pap smears and getting mammograms?
First of all, we have to look forward. We are where we are, and I think that the best advice that non-medical professionals can offer is, again, for women to get educated and to get active in this whole healthcare debate. Women need to advocate for themselves and for their own needs and for the needs of their families. And we've got our work cut out for us as legislators here in New Jersey to make sure that at least here in New Jersey the best information is provided and the very best of health care is available to everyone.
That's right. And put a human face on those numbers, because I think it was a lot of number crunching and a lot of scientific data that, quite frankly, sometimes is opposite of common sense and the really humanistic approach to medicine.
Ladies, thank you very much for joining us.